Level 2 Trauma Center is the designation given to a hospital who has met the national standards for trauma care. It's a very vigorous process to go through, and about 40% of hospitals who attempt to become certified will fail that process. So it takes an incredible amount of resources and commitment from administration, physicians, staff in the community to meet the needs of the trauma patient.
Level 2 trauma centers and Level 1 trauma centers have been proven clinically in multiple studies to deliver better overall trauma care with better outcomes, better survivals, with less complications, less problems.
Unfortunately, a hospital is not an isolated organism, so you come to the ER, it's not just the ER that has to work properly, it's not just the ICU that has to work properly, it's not just the OR that has to work properly. Our trauma system meshes all of those programs together with all the physicians that we need to treat massive acute trauma.
You have to have trauma surgeons available 24/7, 365, as well as a trauma team, which involves a trauma program manager. All of the emergency physicians have to be board certified in emergency medicine, as well as being current in all of the trauma protocols. All of the physicians on the trauma team, including the general surgeons, the specialty surgeons, and the emergency physicians, are required to complete a large amount of continuing medical education requirements each year. And those are the physician requirements. The hospital as a whole has to have dedicated ICU intensivists, surgical intensivists, and again, we have to have a specific trauma quality improvement program with verifiable outcomes.
You can expect, if you're a level 1 trauma, that you will get here by some form of EMS, either AirMed, which accents our trauma program, or ground level EMS from one of the surrounding communities. You will be met at the door by an ER physician. You will be evaluated immediately, including ultrasound and laboratory evaluation by an ER physician. The trauma physician will be involved within 10 minutes, and if you need to be in the operating room, you can be there within 20. A trauma center benefits the people in the community because you're going to get much more effective, faster trauma care if you come to a trauma center.
When someone comes in who has major traumatic injuries, it is extremely important to have available immediately an entire trauma team, which includes the trauma surgeon, who is immediately available and in our department in less than 10 minutes from the time a trauma arrives, and often meets the trauma and is here prior to the trauma.
We have an incredible amount of pride in our trauma status. We work very hard together as a team. For example, we just had a patient that his probability of survival was 0.0034%, so no chance of surviving. But because we work together as a team, a patient like this comes in and he was in a car crash and his heart exploded. Had 2 holes in it, and we were able to go in right here in the emergency room where we're sitting now, open his chest, and do a temporary measure to keep oxygen to his brain, while we then rushed into the OR and we repaired those holes while we gave blood, and his heart started beating. We were ecstatic. Nothing can bring you together closer as a trauma team than a save like that, because that's why we're doing what we're doing.
It's important to have a educated team of physicians and nurses who know how to expeditiously deal with a trauma patient. They often talk about the golden hour of trauma, but in reality it's probably the golden 15 or 20 minutes that make a huge difference. And if you don't have a dedicated, trained entire team, which is, as I said, physicians, nurses, respiratory therapists, radiologists, the entire team, then you cannot adequately take care of the patient and your outcomes are poor.